to be a senior leader, I was becoming one, but to be a senior public health advisor, I thought I needed a little more content-based expertise. So I enrolled in the program. It was obviously the one that fit my needs the most, and I once again thought it was probably the best education that I had of all the different places I've gone. Probably first, it was credibility. So I think most people know Massachusetts in general is an area of great public health. It's got a lot of best practice sort of academia, a lot of research and development comes out of Massachusetts in terms of public health. So it carried with it, one of the multiple schools that had the credibility initially. UMass has a good public health program in general, but the online program. So that was the number one piece of credibility. The second piece was the relationship I quickly developed in deciding, I think I had spoken to actually all pretty high up real fast. I think I was at the time, in the military, I was, sort of getting to be more senior roles, and given where I was, I actually spoke to one of the deans at the time and really got a good, sort of recruitment piece from him, and it worked on me. And then the third thing, which most people will say with a program like this, it blended the ability to be flexible with also the ability to meet and team and partner with your other classmates who brought executive level content and expertise to the table, which to me is what catapults it beyond any education I had in the past. Because when you're in other educational settings, you generally take care of yourself and you do it. And you would think in a online program, you would be more independent, but you're really, and you are in terms of schedules, but in terms of learning from others, it's a much better environment to learn from others, and in the way that UMass executed the program. The online program had forums where we could always interact with our classmates, and it forced you to do that online, and so it was easy to connect. And it was the beginnings of Skype when we started, I believe, in summer. So it wasn't quite what this is right now in this interview, but we were capable of doing it and meeting. And to tell you the truth, I still have very close colleagues that are very senior people in their fields that are friends of mine now because of the MPH program. And so surgeons and all sorts of disciplines and health professions. So it was a great form to do that. And we had interaction with every level of faculty that we could possibly imagine, including some of the deans that were teaching our courses or associate deans. So a very intimate group. You certainly don't feel like a number or a statistic in any way, shape, or form. It is them trying to help you gain as much knowledge as possible, complete the curriculum. But it wasn't really about, we want to complete the curriculum, we want you to graduate from UMass. It was really like, how do we develop your expertise in public health? So the practicum actually helped catapult my career, because I did a lot with HIV/AIDS while I was in the Asia Pacific. Ended up, one of my roles in my career was the director of the HIV/AIDS program for the Indian Health Service nationwide. And it also parlayed into authoring a piece of the very first national HIV/AIDS prevention plan for President Obama.